show you how we applied it to a new evaluation, which we call our practical exam. We'll get to that in a minute. So for today, like all good educators, we have objectives, right? We want to just talk a little bit about authentic assessment. There are 8 elements of authentic assessment which have been identified by scholars, and look at the rationale for why we want to use authentic assessment, and then talk about our practical skills exam, the challenges that we encountered, and the adaptations that we made to improve the use of this assessment tool. So authentic assessment is defined, if you're not familiar with it, as an evaluation that directly examines students' performance on an intellectual task or performance. It needs the student to use their knowledge and to apply their knowledge and not just recall it. Students need to demonstrate competencies, combinations of knowledge, skills, and attitudes that they need to apply in a similar situation in the workplace. So to design authentic assessment, educators need to decide what is the actual performances that they want and what we want students to be good at. And we want to know if students not only know the content, but if they're able to apply the content and use it in real life situations. I really liked this quote by Cook and Clipfield. They stated, "For something to be truly learned, the information or process not only has to enter memory, but also has to get out again to be applied to new contexts and situations." Although they were talking specifically to active learning here, this applies very directly to authentic assessment as well. So the 8 elements of authentic assessment include that it has to be challenging for students, that they have to produce a product or perform a task. The activity requires that transfer of learning, not just a demonstration of a skill, not just a regurgitation of facts. And that they demonstrate some metacognition. That if somebody from the outside came and watched who's a stakeholder or somebody who is a client, they'd recognize that this product or performance was directly related to the field which they are in. And the fidelity of the assessment needs to fit within actual reality in the workplace as well, in the outside workplace. This assessment activity needs to require discussion and feedback, and finally, it requires that students collaborate with one another.
So Julie and I are faculty who teach in the junior year, and we teach in the Skills Lab courses. And those are courses in which students are being taught, the professional skills of nursing. And 5 years ago, we introduced a new kind of laboratory assessment in those junior skills courses. We introduced them because we wanted the students to demonstrate a higher level of critical thinking, clinical reasoning, and skill application than objective multiple choice exams. We called that assessment a practical exam, so it was a new kind of test that we created. For many years we have conducted other assessments that have components of authenticity, like performance exams, skills performance exams, where students are performing a clinical situation, some sort of situation, and a faculty is observing them and grading them. Or we also have students record themselves performing a skill, and then we view the videotape and score it. But this was just a different form that we hoped would capture these concepts of authentic assessment. And the practical exam is grounded in authentic assessment because students must demonstrate the thinking and reasoning skills that are essential for professional nursing practice. While the primary emphasis in skills courses is on doing it right, the practical exam corresponds with literature that demonstrates a learning benefit from identifying errors. And so the contemporary emphasis in healthcare on quality and safety requires students to develop high-level situation monitoring and correction skills. And the practical exam requires them to assess the environment, identify errors, indicate what they would do to correct the situation, and then provide the rationale for those changes. So how do we conduct a Skills Lab practical exam? We schedule approximately an hour and a half for each exam. Scenarios are developed for each content area that is going to be on the exam, usually 5 content areas per exam. And a station in the lab is created for each of those scenarios. We create a testing schedule in which groups of students rotate through those 5 stations, and they spend a set amount of time in each station. And after a brief introduction in the classroom, the students go to their assigned first stations and the exam begins. So this is a picture showing students at a station where they're given some space to write, because each student is given their own test packet, and this is not a multiple choice kind of exam. They are writing throughout the entire exam. So there are our three main exam item types. The first type is a low fidelity simulation with a static patient scenario. So we create these static patient scenarios with a mannequin in a bed. And one example of a skill that might be tested in this way is a chest tube drainage setup. So in this case, equipment and the mannequin are set up, and we are creating intentional errors in the setup, in this patient situation in the bed. And so the students must identify the errors, state how they would correct it, and why. And so then in all the item types, in all of these item types, we actually allocate the greatest number of points for the rationales, because we really want to uncover their thinking. We want them to be able to explain the why of their practice. A second item type is a recorded video performance of a skill, and in this case, faculty are the faculty who will perform. Julie has been a star. She's one of our, she is. She's like really quick to say, yep, I'll record that one. And so the faculty is actually being videotaped performing the skill, again with intentional errors in it. And so the students watch the video and identify errors, state their corrections, and then provide the rationales. And a third item type is a brief case study with visual cues. And the visual cues may vary from a printed ECG rhythm strip, a medication administration record, or a prepared meal tray. So students must perform the skill that's described in the case study. For instance, they may need to count the number of carbohydrates that are on that prepared meal tray, or they might need to calculate a medication dose. And again, they have to provide the rationales for what they describe. And so here are some more pictures. So this is showing students gathered around a bed. So this is that static patient scenario. And you can see that they each have a clipboard. They've got their test packet. They're standing separately. They're told they're not supposed to stand right beside each other. They can't look at each other's paper, and they're very busy writing. It's very quiet, and they're just very busy writing. So some logistics have been essential to the success of the practical exam. Because we place a high priority on the rationales that students provide, we provide extra time, about 20 minutes after the rotations, for the students to go back to the classroom and complete the writing. Students aren't allowed to talk during the exam. They have to stay at their rotation, at the rotation that they are currently in, until they're signaled to move. And some students may finish early, but they have to stay there until the signal is heard that they move to the next station. They have to protect their clipboard, their test packet, to maintain the privacy of their answers. They're not allowed to touch any part of the setup. And this is essential because groups of students are rotating through those scenarios, and if a student moves something, if they change something in the setup, then any student rotating past into that station afterwards won't have the same visual cues, and it can affect the validity of the test. And so this is another picture. You can see there's a there's an item on this tray, if there's things placed in the environment, those are things that students need to attend to and evaluate them.
This past year, we added collaborative testing to our practical exam, and it's been a very good way to evaluate, for students to self-evaluate their learning and to remote learning. Recent studies have shown that collaborative testing really improves exam performance and promotes positive student attitudes. Now, that may not be that surprising if they can work together and get a better grade, but some researchers have also found that collaborative testing encourages positive problem solving and emphasizes long-term retention of information. This was demonstrated when they did a pop quiz 3 days later after a collaborative exam, as opposed to not having one. Improved scores were after the collaborative exam rather than without. Students who have participated in the collaborative exam have noted the importance of being able to discuss and debate their answers. It really makes them reflect on their own knowledge, like what do I know and how do I share this, give the rationale behind what they're thinking, and they have an opportunity to learn from each other, which is wonderful because then they're learning while taking the assessment and just not demonstrating their learning to us. So again, as students hear their others' rationale and answers, they think on their thinking. That's that meaning of the promotes metacognition as one of the 8 items that belongs in identifies authentic assessment. So we just put these together, our eight elements of authentic assessment and our practical exam and how it fits up with there. Students do verify that this is a very challenging type of assessment, and we'll talk more about that in a few minutes. We do require them to have a product, and it is their rationale, their actions, what they would do in a scenario-based assessment. It requires them to transfer their learning. It takes a lot of learning they take in other classes, and they have to apply it here, as well as learning that they earned in skills class. There is a definite similar scenarios are found in clinical. You hear students come back and they say, that chest tooth error that we talked about, I saw it when I went into clinical this week, and it makes them much more aware of situational awareness and training them to look at things when they walk into patients' rooms. The Skills Lab is a fabulous facility. We are so blessed to have it in nursing, and it really allows us to have very realistic settings. It also requires that discussion and feedback, especially during that collaborative part. Both of these last 2 elements of authentic assessment are met there.
So we learned some tough lessons when we were first implementing this type of assessment, and we want to spend some time talking about some of the challenges that we experienced and the adaptations that we have made. And these are challenges specific to our this type of assessment, but perhaps could translate to other kinds of authentic assessment, for departments that might be developing these kinds of assessments. So the first challenge that we encountered was inadvertent errors. And I already told you that when we set up these stations, we create intentional errors. But early on, we failed to notice that we were making inadvertent errors, unintentional errors in the setup, because we were focusing on a very kind of small set of skill-based errors that we wanted students to identify. We were failing to recognize all the other cues in the environment and some of the just things that we just didn't notice. And what we learned is that we drill certain things into our students early, okay? We drill into them things like what position the bed should be in and what position the side rail should be in and things like that for safety. And what we were learning is we were wanting students to focus on a more advanced skill that we had taught them in a particular unit, but they were getting caught up because this bed wasn't all the way down, or this side rail was down and it was supposed to be up. And so we realized that was an inadvertent error, and it distracted the students from the actual skills that we wanted them to identify. And so Julie's going to talk about some things that we did to correct that.
So as an adaptation, we now walk through our practical exam scenarios with multiple instructors just to see if we are finding and seeing things that are these inadvertent errors. We also make a big point of telling students this is not we're not focusing on safety errors today, we're focusing on chest tubes, we're focusing on whatever. So please, even though we try very hard not to make those errors, don't get caught up in those. We track our inadvertent errors. The lab keeps a nice list of the things that we've done wrong so that when we go back to the setup the next semester, we are able to make sure that we didn't make that error again, which is wonderful for us. What's very interesting is students yesterday in lab got to set up their own scenarios as practice for the next final, and they made inadvertent errors, which kind of made us chuckle.
It's really hard. We have learned how challenging that is. A second challenge that we encountered was time. In our first use of the practical exam, we scheduled time for each station, and then we collected the tests. But we were dissatisfied with the level of the rationales that the students provided, and we received feedback from them that they didn't have time to write, enough for meaningful rationales. We also learned some difficult lessons about the video performance station. For the first time we did the test, we set it up so that small groups of students were watching the video on a shared screen, like in a room. And the students weren't allowed to control the playback of the video. And so we learned that this didn't accommodate the variety of processing modes that the students have. And then we also encountered another time threat with the videos. We had prepared a 9-minute video for a station that lasted 12 minutes. So they didn't have any opportunity really to watch it again, and it was just too long. And then another threat that kind of relates to time is that we were overzealous about the number of errors that students needed to identify within a particular testing situation, and so just the time element of taking the time to look for 8 errors instead of 3 errors was a problem.
So these fixes are follow very logically from what Ann was talking about. We added that extra 20 minutes at the end for them to just be able to finish their rationale, made videos short enough so they could watch them multiple times, and put them into the computer lab where they have control. They can stop it if they see an error and write it down, and then advance it again without losing their place. And then we limit the number of errors. We actually intentionally make one more error than what they're required to find, so they don't panic thinking, I can't find the 3rd error when we say there are 4, but we have to identify 3, which also gave them a little more freedom when they were choosing which errors they wanted to write about and give their best rationale for.
A third challenge we encountered was poor inter-grader reliability in grading the exams. In our Skills Lab courses, we have 45 students in a section, 3 instructors, so each instructor has 15 students in a grading group. And early in our use of the practical exam, each grading instructor graded the exams of our students that were in our grading group. We used an answer key. The answer key was written for each station, for each scenario, by the faculty who kind of was in charge of that scenario and had written the scenario, and so then they wrote the corresponding answer key. But as we were grading that and using the answer key, we just realized that the variability in student responses wasn't anticipated by the answer key. And so we had to spend quite a bit of time resolving, talking about, okay, this is what students are saying. Should I take off a point for this? Should that be a half a point? It was really stressful and exhausting, and it was not helpful.
So now one instructor, preferably the instructor who designed the content, designed the scenario, grades everybody's scenario. So you, instead of grading 15 of 5, you grade one scenario of all 90, or all 45 students in your section, probably all 90 students if it's the same scenario. So that helps with continuity and be able to decide, I'll accept this answer as a partial credit, and this answer is a full credit, or this one not at all.
And we that's affected how we print the test, because we make sure when we print the test that each scenario is on its own page, and then when the students are done taking the test, we separate test packets. They have to write their name on every page of the exam, and then we separate those test packets and split them up among the faculty, and then we reassemble the test packets after we're done grading them. A fourth challenge was student experience with this form of testing and skill. We underestimated the effect of several forms of student inexperience on the reliability and validity of our exams. First, by the time our students enter the junior year, we realize they are well schooled in multiple choice exams in which the correct answer is provided for them. They know that one of those 4 options is the right answer. And our students rarely encounter essay or short answer tests in which they have to express an answer in their own words. They're also still novices in surveying a clinical situation and being able to see items of importance. As experts, we forget that exposure and experience hone our ability to quickly focus on the items of highest importance in a clinical situation. And junior students don't have that experience with that. And so to a novice, you walk into a clinical situation and every stimulus appears to have the same value. And so they're walking into this clinical testing experience, and we quickly see those things that are wrong. The students don't have that experience. So while we teach situation awareness in the clinical experience, we're at the same time, we're requiring them to use that skill then in this testing experience.
So several adaptations we made. The first one was the very first time they do this, we have a whole practice day where we just set up errors in different scenarios, walk through them, give them feedback, talk through rationale so they can hear what level of rationale we would like to hear. We do also write up scenarios and set up practices for each other and have the students do that, like I mentioned earlier, and that gives them practice in thinking what errors could be possible and what could I see, and therefore heighten their attention to the right way to do things as well. And then we integrate testing stations with new material. So if we teach about chest tubes, we'll go with that one again, chest tubes, then we have a station set up as part of that lab day, that content day, where students rotate through there and identify errors as they're learning the material. We like to have a perfect setup and one with errors so they can do the compare and contrast and find those. We also created a tip sheet for studying so that they know how to best study and prepare for practical exams.
So building on that previous slide where we talked about student experience, we learned that we have to level the exam realistically. We were initially very enthused about this new kind of testing, and our enthusiasm kind of likely ignored the developmental nature of skills. And as I mentioned earlier, students initially focused on those really foundational safety skills, and they felt punished for noticing them because they got it wrong on the test. And we found that to be a student discourager. And the first time we did this, we had to dig ourselves out of a huge trust pit. It was very painful. We ended up curving the exam. We gave everybody an extra 15 points or else they would have all failed. And we had to compensate them for our own lack of experience with this.
So now we make sure we begin with very foundational skills. The complex skills come in the second semester, the easier skills in the first semester. And the practical exams increase in difficulty over the entire junior year as well. The integrated scenario occurs at the end of junior year. So now instead of just simple scenarios they do the end of this year, they'll do integrated scenarios, so they have 2 of 3 systems that they're going to have to find errors in, which is much more similar to what happens in a patient room. They don't usually have just one thing going on, they have multiple things that they need to identify and be aware of situational awareness with.
Another way that we elevate the challenge is that we give them less time for each scenario in the second semester. So we're challenging them to use that knowledge much more quickly.
So we have done some student feedback, just looking to see how they feel about it, and we feel very strongly that they support this type of testing. Initially, like we said, it was they were not happy, but at the end of the semester they figured out this was really helpful and we really did learn a lot. And we got better at preparing these types of tests too, which makes a big difference. So that's our presentation. We just wondered if you had any questions or ideas or thoughts or
Maybe some examples of how your department is using similar, kinds of authentic assessment.
Could you give some examples? As a clinician, I'd just be curious to know what some examples of errors would be. I mean, and how obvious, or, I mean, I don't know if I passed. But it'd just be interesting to know how you set those up.
Sure. Why don't we go back to some of those pictures and we can show you. The one with the patient who has the lettuce in front of them is a patient who just is a brand new ostomy, ileostomy, and they ordered their first meal. And the first meal should not be something high in fiber like lettuce. I don't think you can see on the picture, get there eventually, the picture that they can also see the ostomy bag, or when the ostomy bag's not put on correctly. If the hole is cut too wide for the ostomy instead of being just a quarter inch around, and it's not pointed straight down, it's tilted on the side. I'm trying to remember. I think the other error is in the statement that the patient makes. The statement in this scenario states, I decided not to drink too much water because the stool in my bag is so watery. So there are 4 errors there, and they have to identify 3 of them.
And do you make those errors up, or do you have a source that you can use?
We make the errors up, yeah. I mean, for the chest tube one of the errors would be that the drainage tubing is pinched in the side rail of the bed so that it can't drain, and so they. And
Which happens all the time.
Yeah, and we teach them when we're teaching them about, using the equipment properly and, proper setup and the things they need to assess about that system anytime they have a patient with a chest tube. So they should, we're expecting they can recognize that if it's pinched in the side rail that that's wrong.
When our students learn a skill, we provide them with a checklist, so it has the steps in order, and then next to it gives rationale in their textbook of why the step is important. So when we make an exam or make a scenario, design a scenario, we go back to those checklists and say, all right, this is going to be the error, pick out something, so that it isn't out of what they've learned, but they should be able to refer back to the checklist and say, yes, this obviously is not the correct order or the correct way of doing it.
Just a quick comment and then a question. So any form of assessment, it could be traditional assessment or performance assessment, it can really be a formative assessment or it can be summative assessment, okay, depending on how the results are used. I'd be curious to hear how you would think about using this this assessment in a formative way. In other words, how has it really informed your instruction in terms of learning what they know, what they don't know, and then being able to move forward with that knowledge? And how for students has it been really formative too? So good assessment is actually a learning experience too. It's not just a score that goes in a book somewhere. But how have the results been used in a formative way for you and for students? Just curious.
Absolutely formative for both. If we recognize a certain error that all the students or many of the students did not do well on, we'll return to it when we review the exam and talk behind that rationale. If that is the chest tube scenario that's coming up, that's a real good example this year. I totally redesigned that unit based on results, and we got a better result this year because of that. So it does inform, I think, both our students and us. And the fact that now that they do the collaborative and they think the teaching and we follow up the next class period when the tests are returned and talk through the errors, I do think it's formative as well.
And the fact that now when we teach a content area, we create a setup, the station that they can go and learn from that. That was an attempt to make it formative so that they weren't encountering a completely new assessment as a summative assessment as well.
Other questions?
Can I play devil's advocate a little bit too?
Yes.
Okay. So with performance assessments, there's actually 2 related issues to it. Sometimes the idea of validity of the assessment and the idea of reliability of the assessment. And with 5 exams that they have, one could call into question the reliability of a little bit, of the assessment. And especially if it appears that there's not inter-rater reliability now, you have one instructor that's really assessing each of the scores. So just your thoughts about how you can kind of ensure some validity of this. Are you really measuring what you need to measure? And, is there consistency in these results in terms of the reliability? So I'm throwing kind of a tricky question at you, but just curious your thoughts on that.
I guess the validity piece to me would be if we could say that these errors mimic errors that you might see in practice. And I would say, I think we're not trying to identify obscure components of the skill. We're trying to identify actual problems that could occur in practice.
Most of them come from our own experience.
Yeah. So I would hope that gets at that idea of validity, that it is similar to what they would experience in a clinical setting, which is actually one of the elements of the authentic assessment, that an expert could come in from the outside and say, yep, that is actually something that could happen in this field.
When it comes to inter-rater reliability, although I might grade all of this scenario, we frequently will send massive amounts of emails back and forth and say, okay, I'm getting a lot of this answer, I'm thinking that this is what we're going to give for this, and we do communicate with that. So it's not as if only one instructor has the decision about what answers we're going to accept and which ones we're not.
It still is a team
yeah.
effort.
The thing we've learned is that this type of assessment, it requires massive amount more of work for instructors than what your Scantron does. But we also know that when our student nurses enter into practice, multiple choice answer of their patient's head will not appear, and they're going to have to figure it out on their own. So because of that, we decided we really need to move away from multiple choice in the lab and have them actually make decisions based on what they see in front of them. But it is more work, and that's true in literature too. If you take a look at authentic assessments in different research, they'll tell you this increases instructor workload.
Linda?
Yes, it sounds so good to me, especially as, if I were a patient, I'd like to know that people figure this out. Is the senior team interested in doing some of this also, or are they doing some of this?
Yes, the senior team does have their version of a practical exam.
Mhm.
They use a lot of videos and a few setups, right? There's somebody in the senior team, both these places. Right?
We did it in Pizzo B. That was for a scenario that was centered around them going in and being able to find the errors, and then had a video as well too.
I think the video is a really great tool to use for senior level because you can capture a little more complexity in a video than you can in just a static setup. There's just a lot more going on that you have to observe for, and it's moving. It's not just everything is sitting there, and you have lots of time to observe that.
Which hopefully matches their development then.
Right.
They're more at a level to accommodate that type of complexity.
I want to thank you for bringing this to the department and all your work to think about it, prepare it, and the senior team did try it out then after you, when we benefited from you going through it first and the things you learned. We still had some bugs to work out when I was teaching that. And also just another thing adding on to what Jay said, maybe about content validity, is you both are in clinical, you see this every day, but you might also ask a manager or a staff nurse, what are the most frequent errors you see with this skill? And then bring that back. It's probably the same things you're doing, but it could be another way of saying we have content-based validity on this.
Interesting. Go ahead, Brian.
I kind of use the same kind of tool in my finance class at the end of the semester with a simulation. And I have them do it in groups, small groups for collaborative, because I'm trying to move them away from tests also into the decision-making mode. And the thing that I way underestimated when I first started this that I really enjoyed is how much my best students impact of learning in this and bring kids along that I couldn't have ever brought them to anywhere to that, because they're doing this collaborative, and the best students are getting a chance to talk it through, and the students are hearing it from a student's voice, and I just way underestimated the impact of that. Have you seen that too?
We have seen, and students, some of them, I would say the majority of them, are actually going to do research on collaborative testing this coming fall in our department for this course and for another course that we teach. But students have mentioned that they either feel really encouraged because they learn so much. If they focus on the learning, it goes much better. But they focus on what they didn't get right, it doesn't go, and they feel kind of sad after they finish the collaborative testing. But no matter what, all of them say, I learned so much from listening to my peers, and they're on the same developmental level or much more even ground than, say, your instructor to student is. And sometimes that's just a easier communication channel for them.
Are you controlling the groups on the mix of groups? Because I went from not to, and I can't make up my mind on that.
The first time we don't, but for the second collaborative exam, I'm very intentional about making sure that I have a good mix of students. So the students who have done really well and the students who haven't done so well, I actually take their scores and I create, all the groups have the same average of the scores, so they have good students and struggling students within the same group.
Thanks.
Well, thank you so much for coming, and we really appreciate your questions.